Welcome everybody to Refresh. It's that time to connect, to be inspired, to learn something, and ultimately feel a bit better for this time we've spent together. And that's what Generation W is all about. And I just want to mention that we're all about being thankful as well to Circle K, who has agreed to support our great programming of Refresh as our new presenting partner. So thank you so much to Circle K. And one more note, we are at that time of year when preparation for our mega gathering and connecting, where we amplify this spirit, thousandfold, as Generation W is rapidly approaching. This year, with the theme of the positive and the possible, the ability to hear from incredibly wonderful speakers and storytellers, to be able to help us focus on the good that is happening around us and the possibilities that seem insurmountable, and yet the importance of recognizing just how powerful the human spirit can be, the power of connection to come together to achieve greater things than we could have imagined, the desire to enhance the lives that we live and that of others. That's what the positive and the possible and Generation W will be about on March 24th. Yes, all that and more. And speaking of enhancing the lives of others, I have just returned from the Mayo Clinic, literally within the last 45 minutes. Jacksonville is one of the 3 fortunate cities to have this formidable and incredible teaching hospital. My dad, who's okay, is being released today, but the care, the concern, the knowledge and commitment is overwhelmingly present. So much so that he's mentioned it several times. And as a hospital phobe, I found that very encouraging. My dad is, not me. And all of us know who have experienced the stress of caring for loved ones, to be able to exhale every now and then was so welcomed. So you can imagine my brain is on fire, not only because of personal kind of family issues, but also because of thinking about Gen W. And I was just wondering, does anybody ever get that way? Just put it in the chat. Tell me on Facebook, did you ever brain get on fire? Well, today, I wouldn't say she's a fire woman, not at all. But I've been thinking a lot about the brain lately because it can be self-centered, such as mine. Is it working to full capacity? Or how many of us of all ages, but especially as we age, wonder if our memory is intact? Like how many times we say, why I can't find those keys one more time? And as I've been reading, it is intriguing to better understand just how instrumental the brain is in understanding behavior and how we interact in the world. And that's why I'm so excited, especially today, to be joined by the incredible M.D. Ph.D., Dr. Nilufer Ertekin-Taner. She's a neurogeneticist and a behavioral neurologist at the Mayo Clinic. She leads an amazing team of researchers working to find therapies and early diagnostic biomarkers of Alzheimer's disease and other neurodegenerative diseases. Whew. That's a lot. And so I want to thank you so much. I didn't ask you if you have like a moniker. I'm thinking, in sports, everyone gets a name like NET, Dr. Net. You catch everything in your net, right? Nilufer, but okay, I won't do that. Anyway, it's great to be with you today. And tell us a little bit, if you would, about how you got here to Jacksonville, Florida.
Sure, Donna, thank you so much for having me. And speaking of monikers, actually, my lab team is called the Net Lab, N-E-T.
Right.
So well done.
Okay, there you go, the Net Lab. I love it. Okay. I'm a basketball player, so it's like we're totally connected here.
Of course.
Nothing but net. There you go.
There you go. So thank you for having me. I hail from Turkey. So I'm originally from Turkey, where I did my training up to and including medical school. And I have to say I'm the daughter of 2 neurologists.
Oh my goodness.
So my dad is both a scientist and a clinician, and my mom's a clinician. And so there was a lot of neuro talk in my household at the dinner table. And I always found, I was curious by nature, I still am, and finding out about human biology, especially the brain, which is, I would dare say, the most complex organ in the universe. That always seemed very exciting to me. It's like being an explorer. And I wanted to find out more about the brain, both in its health and disease. So after medical school, I decided to do further training in PhD and then residency, and that's what brought me to the Mayo Clinic. And of course, Mayo Clinic is a place that combines in our three shields: education, research, and of course, clinical care for our patients. So I knew that I was at the right place. I did my Ph.D. training. I started my research in the genetics of Alzheimer's disease, and I stayed there. And I did that at the Mayo Clinic, Jacksonville, Florida site. I then went to colder climates to Mayo Clinic in Rochester, Minnesota, where I did my neurology residency. My husband and I are both from Turkey, and at the same time, he was doing his training in general surgery. I'm married to a transplant surgeon, by the way, and we have two daughters.
Oh, wow. Okay. Do they transplant brains yet?
No. And
oh, okay, just curious. Maybe that's
ongoing joke in our family. He says, like, liver is the most important organ. We joke, of course, and I say, no, it's the brain, and of course, it's all very, very important.
Okay.
And so after residency, I came to Mayo Clinic in Jacksonville to join the staff, both in neurology and also to establish my lab team. And currently, I'm a physician scientist. I have a team of about 20 scientists in NetLab, and we study Alzheimer's disease, and our mission is to find cures and diagnostic biomarkers for this condition. I'm also a neurologist, and I see patients with dementia. So that's my story.
Okay, and there you have it. It's unbelievable, right? And it's so comforting as well. We hear so much about Alzheimer's these days. We're going to talk about why the discussion and the focus on Alzheimer's has been raised so dramatically. But you sit home and you say, okay, who's thinking about this? Who's trying to figure it out? There's no cures. And here you are with 20 physician scientists, like looking at trying to figure out how to cure Alzheimer's. So tell us, let's start there. Let's start with Alzheimer's. Tell us a little bit about what we should know about this disease.
Sure. So a few things, a few general things. So there's always this question of Alzheimer's versus dementia. Think of dementia as the umbrella term. Dementia means an individual is having problems with their thinking, but it's at a level that interferes with their day-to-day life. So here we're not talking about occasionally forgetting where your car keys are or occasionally forgetting the name of that famous actor. It's beyond that. And there's different types of dementia. Under the umbrella of dementia, the most common cause of dementia is Alzheimer's disease. Alzheimer's has a specific fingerprint in the brain. When we say Alzheimer's, we're talking about specific changes in the brain, accumulation of sticky proteins, accumulation of things that interfere with the normal function of the brain. And Alzheimer's is very, very common. There is more than 6 million people in the United States who live with this condition, and more than 50 million across the globe. Now, if you consider that every Alzheimer's patient also has at least one care partner, you can calculate the numbers, the large impact that it has worldwide. But there's a silver lining, and that is the fact that, like my team, there are armies of scientists and physicians working on this condition, where their mission is to find a cure for this condition. So I'll stop there, Donna. There's much to say, but I'll
No. I'm inviting everyone to, because I'm sure people have personal questions and whatever. But okay, we want to take this little step by step.
Yes.
All right. So there's these sticky proteins. We've read about them. Maybe we haven't. I guess the biggest question is, how do we make sure we don't get it?
Right. That's the I don't know, $50 million is a priceless question.
Priceless.
It's a priceless question. So if you ask me, is there something or a list of things that I can do that will guarantee that I'm not going to get it? Then my answer to that is no. We can't guarantee that you're not going to get it, but it's like many, many other things in life. However, if you ask me, what are those things that position my brain to have the biggest power, then there are many things that we can do and that we should be doing. I'll tell you about them. One very encouraging result in my mind is that there are studies which look at these lifestyle changes, positive lifestyle changes that we all can make. And these studies show very favorable outcomes in terms of preserving good cognition, even in those individuals who start showing some signs of cognitive decline. So bottom line, I think we can empower ourselves with this knowledge, and I think we can do some of these things to preserve our brain power for as much as possible, for as long as possible. Donna, I'm happy to start talking about them if you think now would be a good time, or I'll sit back.
No, you know what? I think let's start with the positive, and then we'll go into the possible. That seems to be our theme, right? And you are positively amazing. So why don't we start with some of those things? But before we do, Aline, hey Aline, is stealing things a symptom? Noticing impatience and lack of trust and anger is increasing while mind is relatively sharp. Stealing things a symptom. Interesting.
Yes. So Alzheimer's disease, as well as other dementias, can present with many different symptoms, including changes in behavior. And in perhaps, in just by looking at the symptoms, it's not possible to say it's definitely Alzheimer's or it's something else. So we start from the symptoms, but then we do a series of tests to see what our patient is most likely to have. And I'll go into that in a minute. There's another question which goes, I have had 2 grandmothers with Alzheimer's dementia, very scary. Are women at greater risk? So I'll talk about women and Alzheimer's. I'll talk about symptoms. And the only way to truly diagnose Alzheimer's through dissection of the brain post-mortem. Many people are diagnosed with a form of dementia, but this is a clinical diagnosis, does not mean that is truly what is happening in the brain microscopically. That's spot on. The only definitive diagnosis is definitely looking at the brain tissue under the microscope. With that being said, there are now increasingly more reliable biomarkers that we can measure in our patients who come to the clinic. So that's another positive. It's a big development and a very useful development in the clinical diagnosis of Alzheimer's disease. So before I go into the symptoms in women and Alzheimer's, let's take a look at how we can boost our brain power. And there's
actually, Katie, that's what we should have said. Boost our brain power. Yes, let's do it. Let's boost.
Yes. So enhanced cognitive reserve. So what is cognitive reserve? We each have this cognitive reserve. There's many different definitions of it, but think of it like this. Despite the fact that there may be some adverse things going on, being able to go on. We all have reserve. We showed this reserve during the time of the pandemic, and brain likewise has a reserve. The way that we can enhance cognitive reserve is through engagement, cognitive engagement, social engagement, and also physical activity. So how do we engage cognitively? By doing those cognitively stimulating activities, whether it's playing a piece of sheet music, whether it's doing crossword puzzles, reading a book, engaging in volunteer activities, or engaging in a job that stimulates your brain. There are many ways of doing enhancing cognitive reserve. I find that one trick is doing the things that you love, just for the sake of trying to enhance your cognitive reserve. Don't start trigonometry, for example, if that's not your thing. So enhancing cognitive reserve. Early detection and treatment of depression and sleep disorders is also very important. More and more, we're finding that there's a link between sleep problems and mood problems and dementia, including Alzheimer's disease. We don't quite know which is the chicken, which is the egg. But what we do know is depression is treatable, and many sleep disorders are treatable. So if you have or you notice in your loved ones problems with their mood, please do seek help, and please do seek help early. likewise with sleep disorders, if your partner is telling you that you're snoring, you're stopping breathing in the middle of the night, you might have what's called obstructive sleep apnea. Definitely treatable. So make sure to address those things that are treatable to give your brain the best chance to boost your brain power.
So wait, doctor, let me ask you a question here. You say depression. Tell me, because so many people, especially today, we're reading so much about higher incidences of anxiety and depression. Where does that fit in with all of the brain science that we're learning today?
Right. So we are just beginning to scratch the surface of all of that. There are certain things that we know. We know that in dementias, there's a higher rate of mood problems like depression. And we also know that in individuals who are depressed earlier in life, there's a higher likelihood of developing different dementias. So we don't know whether individuals are predisposed to both of these things, mood problems earlier on, and then different types of dementia later on, or whether one leads to the other. And certainly there's also such a thing as situational mood problems. Certainly we've all lived through that with this horrendous pandemic. Hopefully we're coming out of that with many different things that boost our immunity. So there is such a thing as situational depression, anxiety, etc. I think right now, what I can say is that there's a lot of focus on this, the interaction between mood problems, psychiatric problems, and degenerative dementias. We're beginning to scratch the surface, but there are some practical things we could be doing, things that boost our mental health, quickly addressing any mood problems through your primary care physician, and if needed, through seeking psychiatric, psychological help would be the best thing that we can do for our minds. I know that sometimes there can be a perceived stigma associated with, let's say, seeking psychiatric, psychological help. Hopefully, we're getting rid of those stigma. Taking care of our mental health is like taking care of anything else. If we have a broken bone, we go to the orthopedic surgeon. If we're feeling down, then psychiatry, psychology is the way to go.
Wow. Let me ask you, I'm going to ask you, just go back again, and then we're going to go to your other things. Define again dementia for us.
Sure. So dementia is a clinical diagnosis. It's an umbrella diagnosis. It means there is a decline in one's cognition. And I use that term vaguely for a purpose. So it could be a decline in one's memory, but it could also be a decline, let's say, in one's attention, in one's word finding. It could also be a decline or a big change in their behavioral aspects. So that's the umbrella term. But under that umbrella term falls different types of dementia, of which Alzheimer's disease is one. But there's other kinds of dementia. There's vascular dementia, there's frontotemporal dementia, dementia with Lewy bodies, etc. And Alzheimer's, as one of our audience members pointed out, has a specific fingerprint in the brain. That's why we call it Alzheimer's disease. And that fingerprint we can definitively see in a brain tissue, but we can see biomarkers of that in living patients by other means as well that we can get into.
Okay, so all of that is really helpful. I just want to welcome, hey, Christina Levine, we're so glad you're with us. Alper and Aziza. Aileen, thanks for your comments, appreciate it. I see that Jackie's here, thanks, Jack. My brain lights up when we're able to connect, so that's awesome. Do anxiety or sleep medications increase risk, do you think?
Right. So unfortunately, there is this misperception that if we use anxiety medications or sleep medications, that increases the risk of dementia. So that's untrue. But here is what we know. There are certain anxiety medications and there are certain sleep medications that, as a side effect, can influence one's cognition, especially those medications that we refer to as benzodiazepines or benzos. They can slow our cognition, and that could be perceived as, well, maybe it's leading to dementia. Whereas in truth, certain medications that affect our cognitive abilities have worse outcomes, worse side effects in patients who already have dementia. So the bottom line is that if your care providers, if your physicians, psychiatrists, neurologists, your primary care physicians think that you need certain medications to help control your anxiety or depression or to help boost your sleep, I would say follow that advice and use those judiciously under the care of your physicians, because we do not have any evidence that certain medications lead to Alzheimer's disease or other types of dementia.
Well, that's helpful. All right, now we're back to our brain boosting.
Yes.
Right. I'm so glad there's several of these. But you talk about heart and vascular health and healthy lifestyle and diet. Obviously, we all want to do that, but tell us more specifically, if you could, what that means.
Sure. So a healthy heart equals a healthy brain, and probably vice versa. So all of those things that we should be doing to boost our heart health, our vascular health, also have the double or triple benefit of helping our brain health. So what are those things? A healthy lifestyle, what do we mean by that? A healthy lifestyle is one where we're active. So that also speaks to the first bullet, cognitive activity, social activity, but also physical activity. And my patients often ask me, okay, how much activity should I be doing? So, and this seems to be a little bit of a moving target, but a good rule of thumb is that if you're moving about 30 minutes a day, so brisk walking, 30 minutes a day, 5 days out of the week, that's fantastic. Sometimes some of my patients have trouble with moving, with walking. They may have walking problems. I mean, for those of us who live in Florida, a heated pool is a good alternative to be able to do physical activity, but stay active. Being sedentary is bad from so many standpoints, including one's cognition. Also diet, so Mediterranean diet, foods that are rich in vegetables, fruit, foods that are rich in antioxidants. So think bright red colors, berries, tomatoes, those are things that are good for us. Eating fish is good, and staying away as much as possible from red meat, from saturated fats, and more, cooking with olive oil. Those are the kinds of things that are useful. And then really pay attention to those aspects of your health, like your blood pressure, your glucose levels, your cholesterol. These are treatable conditions: high blood pressure, cholesterol, diabetes, and what it means is that we need to see all of us need to be under the care of a primary care physician, and we need to pay attention to optimizing our vascular health by treating high blood pressure, cholesterol, diabetes, the healthy lifestyle and diet that I mentioned to you, staying away from things like smoking. And alcohol is a question that comes up. There are some studies which show that alcohol in moderation, so I tell my patients no more than 4 ounces of wine per day, no more than that, may be helpful for brain health. But there are also some studies which indicate that daily alcohol could increase cancer risk. So one needs to be really balanced about it. If we really think about it, promoting heart vascular health, it isn't rocket science, but it may not always be at the top of our mind, no pun intended, and it should be. And then we need to protect against certain things, including traumatic brain injury, because there are some studies which indicate that ongoing traumatic brain injury could adversely impact one's cognition and ultimately lead to certain types of dementia.
Wow. So let me ask you this. I'm going to go number 3, and I always take notes, just so you know. I always take notes so I can go back and look. We talk about protecting heart health, and I know there was a question about women. We have one of the more prominent women physicians on our chat today. women are like, right, leading cause of death is heart disease. Interesting that heart-mind relationship here as it relates to women. I've done some reading about Alzheimer's and other degenerative diseases, the higher preponderance of women in some of these cases. So in terms of gender, tell us a little bit more about what the studies say and how we should be thinking about it.
Yes. So thank you for bringing that up. That it was also one of the former questions. So women and Alzheimer's disease, women and dementia, indeed, there is a higher prevalence of Alzheimer's disease in women. And we don't know exactly why that is. There are some theories about it. So one of the first theories was that women live longer, but now there are studies that account for the fact that women have higher longevity compared to men. And even when we account for that, there is still a higher likelihood for women to develop Alzheimer's and other types of dementias. So then there are other thoughts, including but not limited to, what about education? Does this have to do with women not having access to or not getting as high level of education as men? Could it have to do with the types of work that women are engaged in? Perhaps not as cognitively engaging types of work, but more physically demanding work. Could it have to do with the fact that women are exposed to more adversity throughout their lifetime, and they tend to be more likely to be the caregivers to others? They tend to carry so much burden. Could that have something to do with it? And then there is other theories, like could it be genetics? Obviously, our chromosomes are not the same. Could it have to do with hormones or hormonal changes? And the answer could be all of the above, and an interaction of these. The good news is that the National Institutes of Health and other leading funding agencies for science is paying a lot of attention to this and putting a lot of effort into this. So first and foremost, recognizing the problem is important, and we can say that at a national and global level, this problem is recognized. And again, we know how much we don't know about it. So there are studies specifically targeting this question of what is the basis, what is the foundation for this difference between men and women in the prevalence of Alzheimer's disease, higher in women, lower in men. I will also say that there are other things that we know. For example, when women get Alzheimer's disease, they tend to have a steeper decline. And again, is that because we're capturing women's problems at a later stage? That's something that we need to consider. And for a given amount of brain fingerprint of Alzheimer's disease, women do worse compared to men. And so why is that? We need to think about, given equal amounts of brain Alzheimer's fingerprints, why do women do worse? And again, we need to consider all of those possibilities. And right now, I think as women, men, all of us need to be paying attention to how we can boost our brain health and maintaining a healthy body and healthy mind. Sometimes we tend to forget about our health for the sake of others. So that could be something to keep in mind as well.
Julie, we're going to come to your question, but I just wanted to ask this because I've done so much reading about the pink brain and the blue brain. And I know that you did some genetic work and research early on. Are there significant differences between female brains and male brains in general?
So yes and no. In some aspects, yes. So we know that I mean, from the general size of the brain is different between men and women, because our sizes are in general, like whole body sizes are different in men and women. We know that the mapping studies in the brain have shown us that there are differences in certain parts of the brain, how it's connected. For example, how the language center is connected with the rest of the brain shows some differences between men and women. But we also be very careful when we talk about these differences, because we don't want to indicate that there are inherent differences in cognitive reserve or ability or potential between men and women. So we need to be very careful how we state these differences. Indeed, there does appear to be some differences, and yet that shouldn't lead us to conclude that there are inherent men-women differences in terms of let's say cognitive reserve or potential, if that helps.
Okay, well, here's an interesting question, and there's some others. We're going to get to them. Trish, I see yours too. Jackie Thielen, say hello to Doctor.
Hello.
What are your thoughts on using oxybutynin? Butynin for hot flashes and impact on cognition?
Right. So oxybutynin is not a medication that's liked very much by neurologists caring for dementia patients like myself, because there are certain types of medications that's used for a variety of reasons. So to help with the urinary problems, to help with sleep, for example, and some of them are contain this chemical called anticholinergic chemicals, and what that does is it reduces the levels of a chemical that we know gets already reduced in diseases like Alzheimer's disease. So, for example, in Alzheimer's disease, one type of medicine that we use is geared towards enhancing the level of that chemical. So we don't like it when our patients come to us and they're on the kinds of medications that actually reduce this chemical. And we know that this chemical is important for a number of brain functions, such as memory. So in turn, we recommend that they utilize different substitutes for these medications. So there are versions of these medicines that have less access to brain tissue and therefore less influence on the brain levels of this chemical. So we ask that their physicians switch them to these alternatives. While we're on that subject, actually Benadryl is one that's quite frequently used, for example, to help sleep. So Advil sleep, or these over-the-counter medications that have the sleep word after them often have Benadryl in it, and so that's another medication that we want to mention that we exercise some caution against.
Wow, that's interesting.
I mean, these may be okay, in those individuals without any cognitive problems, but still exercise caution, knowing that they could influence one's cognition for the reasons that I mentioned.
Wow. So let's go back to, thank you so much for that. Let's go back to Julie, who had 2 concussions about 5 years ago, and now she sometimes struggles with finding the right word or remembering what to do. I didn't have any concussions, Julie, and I'm struggling with that as well. But does it mean she's at risk for dementia?
So the real answer is that we don't know. We don't know for sure, because when the studies are done, they're done on a group of patients. And that's the tricky part. In any given individual, it's hard to say, yes, you're at risk, and here is your 15% more risk than somebody who didn't have this. So we cannot give you, Julie, that kind of personalized advice. However, here's what I can say. Individuals who have concerns about their cognition, if they're struggling with word finding, what have you, I recommend that they seek some evaluation, some baseline evaluation to see where they're at. So it could be, it could start with their primary care physician, who could provide them with what we refer to as a bedside screening cognitive test, and see where they're at with that. But there is more elaborate versions of these, and this can serve as a baseline, and it could be repeated, let's say every year or every 2 years, to see how things are going. Now, I'm not recommending that all of us go and seek these in-depth thinking tests to be done on a yearly basis. But if you have some risk factor, such as a strong family history of Alzheimer's or other dementias, or multiple head traumas, and you feel like you're struggling, bring that up with your primary care physician. It's a good idea to have a screening cognitive test, and if deemed necessary, then the following steps could be a more in-depth cognitive test, all the while following those brain boosting tips that are good for all of us, whether we have the risk factors or not.
That's really helpful. Julie, I hope that you found that helpful. And then there's Trisha, who had a TBI, and she does her best to have healthy lifestyle. I've seen her running on the beach many, many times, just so you know, she's really active. Is there an area of lifestyle habits that has a greater impact above and beyond focusing on anything that you mentioned?
Well, thanks for bringing that up, Trisha. Actually, that's an active area of study. There are some lifestyle studies. These are clinical trials focused on lifestyle, where they took certain portions of the lifestyle changes and applied it to individuals, and looked at the outcome and compared it to doing multiple things all at once. And the outcome is that it's not just one thing, but it's doing as many of those things as possible. So cognitive engagement, routine physical activity, social engagement, and then paying attention to all of those vascular risk factors in sleep and mood. It's not one thing, but it's all of those things. And most likely it's because, well, number one, brain is the most complex organism, and it requires many different protective aspects. And in diseases like Alzheimer's disease, many different pathways, many different networks are perturbed. So you need more than one thing. And so I wouldn't say just pick and choose. I would say try to do as many as possible. I think there's another question.
Yeah, Elizabeth wants to know, what are the tests for these conditions, right? There's no blood test that says you have Alzheimer's or not, right? But everybody's kind of, you know, I think everybody's, I think there's a fearfulness around this disease, because as you opened up, you spoke about the number of people impacted, the long-term impact. And I think I have a data piece right here that says there's more than 10 million women either living with Alzheimer's or caring for someone who has it.
Absolutely.
So I think maybe Elizabeth's saying, do we find out or don't we find out? And how do we find out?
Right. So, I mean, what I would say is that it's important to pay attention and be knowledgeable, but also we shouldn't have unnecessary worry about it. And as I mentioned, every day there can be a one-off time for any one of us, and with aging too, we have more difficulty in coming up with names of famous people or names of acquaintances. That in and of itself doesn't mean that we have Alzheimer's disease. When it starts impacting our life, when it becomes noticeable by others, then I think we need to pay more attention to it. So the everyday mild forgetfulness shouldn't lead to the big alarm bells if you are able to carry on with all of the complex activities in your day-to-day life. You're paying the bills, you're caring for the kids, you're caring for the grandkids, you're planning for your trips, you're doing really well in your volunteer activities. Nobody's really worried about how well you function. Chances are the one-off forgetfulness of the word finding, that's normal aging. However, when there's a change, when there's a decline, then time to seek help. And in the first step of that would be with your primary care physician. Let's make sure that you're doing well from the standpoint of, let's say, your thyroid, your vitamin levels are good. Let's make sure you don't have an underlying infection. So this type of a screening is important, as well as a cognitive screen. So the initial small cognitive screen is something that could be done under the care of your primary care physician. And if they and you feel that this requires a specialist care, then a referral to neurology, behavioral neurology specifically, would be the next step. And there, what would typically happen is this more in-depth thinking test, a good brain imaging study, because we want to make sure that there isn't a bleed, for example, or a tumor or a stroke. We want to rule these things out. And looking at your heart health, the neurologist then would put all of these things together and decide the next steps.
Great. So, Katie has a good question. Before we get to Katie, because that'll probably be our last question in terms of time. Someone earlier, I think Don said, is there a genetic, is this a disease that is genetically makes you higher percentage? Like, I know that your parents were both neurologists and you became one. That's a little different than if they had issues with their brains and you have it as well.
Right. So is there a genetic basis for Alzheimer's disease? The short answer is yes. The longer answer is the following. There are two general forms of Alzheimer's disease. One is early onset familial forms, and these make up less than 1% of all Alzheimer's disease. And here I'm talking about multi-generational, generation after generation, there's Alzheimer's disease. Typically it's early onset, and early onset, that's an arbitrary term, but it's earlier than 60 to 65. And there are some genetic factors, big genetic typos. So think of your genetic alphabet. There are letters that make us up, that lead to your proteins, and proteins make the person. And so if there's a big typographical error, then that can lead to early onset familial forms of Alzheimer's disease. But these are very, very rare. The majority of Alzheimer's disease is what we refer to as late onset Alzheimer's disease. And indeed, there's a genetic basis for this. And its genetic basis is far more complex than that for early onset Alzheimer's disease. I would think of it like a balance beam. So on one side of the balance, there are many, many genetic risk factors for Alzheimer's, plus environmental risk factors. So hundreds of risk factors on this side with environmental risk factors. On the other hand, we also have protective factors, protective genetic factors, and all those protective environmental things that we can do. And what determines if somebody's going to get late onset Alzheimer's disease is how that balance tilts. So while we cannot change our genetic makeup, we can change what we do about it. So we can put the odds in our favor from an environmental standpoint.
Which makes a whole lot of sense. And I'm going to say, we're not going to get to all these questions, I do not think. And I'm going to ask you if it would be okay, Dr. Net, if we send you one or two and maybe we can email those people back. But Latrice came up with, like, she really do. With all of the discussion about this disease lately, there has been some pharmaceutical production, if you will. There's been new drugs that have been out there, and there's a new one now, and one that has been approved by the FDA. Yes. Your thoughts on it? Yes.
So the fact that we have an FDA-approved drug is a fantastic first step. It provides us great hope. It provides all of our patients with great hope, but hope and hype. We shouldn't think that this one drug is going to cure all of Alzheimer's disease, but it's a phenomenal first step that gives us a lot of hope. So specifically for this one drug that's been FDA approved, it has been shown to reduce the fingerprints of Alzheimer's disease in the brains of patients with this condition, and it leads to some measurable improvement of some clinical scales. So these are all positive. Whether that's going to translate into very meaningful clinical improvement remains to be seen, but it's a great first start. What gives me a lot of hope, though, in addition to all of that, is the many laboratories working jointly to find a myriad therapies for Alzheimer's disease, because Alzheimer's is such a complex condition. It's not going to have a single cure. Think of cancer. There's cocktails of therapies, and these therapies are customized to the patient. And that's what we're going to see for Alzheimer's disease in the coming years. What we're going to see is a cocktail of therapies tailored to each individual's Alzheimer's disease. And I do know that we're going to see this in our lifetime because of all of the exciting work coming out of so many laboratories, including our own.
Wow, that is huge. Before we leave you, or you leave us, Katie, what are the best ways we can care for family or loved ones who are either dealing with it or showing early symptoms, really knowing how hard it is?
It is exceptionally hard, and it's a huge burden. It's an unmeasured burden. A lot of people leave their jobs or work a dual shift caring for their loved ones. It's a huge burden, and needless to say that this burden unfortunately falls more frequently on women than on men. Right. So how best to care for them? I think in a simple sentence, it takes a village. Each care provider, each caregiver shouldn't take it all on themselves, because it's unsustainable. And we know that caregivers, if they try to do it all, they have their own problems then to tend to down the line. Know your resources, seek help. Alzheimer's Association is a great resource, www.alz.org. They're very active in Jacksonville, in Northeast Florida. You can become a part of their network. Mayo Clinic does a lot of informational sessions and outreach. Make sure that you're part of a caregiver network so that you can have help from that. Your primary care physician, your local neurologist, they're all resources. There are also, what's very difficult for caregivers is, should I keep my loved one at home or not? Have those conversations early on as a family. There are great places, assisted living and nursing homes. Don't be shy to look into these and find what's optimal for your family. There's no one size fits all, and don't take it all on yourself.
Yeah, that's probably good personal advice for me today, but I am thankful to my sister for being so helpful. So Dr. I'm going to get it. Ertekin-Taner, you are a gift. I always take notes. I want to remind all of us that we have to think about boosting our brains. And when we post this ultimately on the web, we will make sure that we cover all of that. This conversation is so much about the positive and the possible. Your positive approach to work, and the fact that you said, I love this. What gives me hope is that there's so many researchers making so much progress, and we will see progress in our lifetime. And so that's also about what's possible. And so here we are talking about this horrific disease, feeling imbued with hope because of your positivity and because of the possibilities you're sharing with us. And with that, before we all leave, let me just share this little video about Gen W, the positive and the possible that's coming up.
I would describe Generation W as powerful.
An amazing, empowering event.
As inspiring. I think Generation W is great, as we say, it inspires us, it connects us, and that we need as a human is connection.
A network of women looking to change the world together.
It's absolutely amazing because I'm able to meet people, I'm able to listen to people, I'm able to, stand in the back of the auditorium and listen in and really get a sense of the topics, the issues, the concerns, and the celebrations that are a part of being here.
I would describe Generation W as a family.
Amazing.
And Dr., we welcome you to that family today. Thank you so much. And we will be back on February 1st. Thanks again to Circle K, who will be helping us bring the 37th annual National Girls and Women in Sports Day. Honoring the achievement of girls and women is in that window. And so we will be celebrating that. And you know what? We'll be boosting our brains and our hearts, because we'll be celebrating the activity and the great sports that women have been able to achieve. We will have Kayla Durden, Jacksonville Beach native, who's a pro surfer, now works at the World Surf League, who appeared on ABC TV's The Ultimate Surfer. She got 2 bites at that surfer apple, and she'll talk a little bit about that. Our dear friend Susie Whaley, the first woman and only woman in over 100 years of history of the PGA of America, to come and join and share her stories of what's going on. And of course, our beloved Taj McWilliams Franklin, 2-time WNBA champion and 6-time All-Star. Please join us on February 1st for the family we call Generation W. Reminder, register for your tickets, whether it's in person or virtual, and join me in thanking, if you will, Dr. Nilüfer Ertekin-Taner, who was just extraordinary today. Thank you.
Thank you, Donna. Thanks for having me. Bye-bye.